You guys here? Yeah, okay, we're good. Well, good afternoon. It's great to be here at Paul D. Stevens School. It's great to be back in Pinellas County. We're here to hear from some parents and some teachers about our view that every parent needs to have a choice about their kids' education, whether they want to continue with distance learning, I think that's the parent's right, or whether they would like to have in-person instruction, because we know a lot of students really need that. And I think the stories are compelling. I do want to give a quick update. We are monitoring Tropical Cyclone 9 very closely. It looks like we're not going to know the storm's exact strength and trajectory for a couple more days. It has not yet been an organized storm. We have not seen the organization, which obviously is going to tell you a little bit more about the severity and the direction. It is going to be passing over potentially a lot more land, which could potentially break it up as well. So it's very uncertain. I know they have different cones now that are out there. We still are not at the point where we really could, I think, credibly anticipate a trajectory, but I do think it is possible that there are impacts in the state of Florida, and we see those impacts as anywhere from kind of severe storms all the way up to potential hurricane. So people just need to have their hurricane plan. They need to secure 7 days worth of supplies, food, water, and medicine, just like you're told to do at the beginning of hurricane season. Listen to your local officials and go visit floridadisaster.org/get-a-plan for more information on how to prepare. But we'll be watching this very closely, and we'll be providing updates as the situation requires. I'm glad to be here. I want to thank Principal Debbie Thornton and the other education professionals here in the Pinellas County School District. I want to thank Dr. Mike Grego for his great leadership of a great school system here in Pinellas County. We know that education changed dramatically with the advent of COVID-19 in mid-March. Parents and their children were in a different situation than they had been and than their routines had been. We had 2.9 million public school students throughout the state of Florida having to continue their school year from home. They didn't have their interaction with the classmates. They didn't have access to the same extracurricular activities. They didn't have access to sports, and obviously they didn't have the face-to-face interaction with their teachers. And for many parents, it meant having to learn how to be a teacher and a daytime chaperone while also continuing to do things like earn a living, which many of our parents obviously need to do. And so this really created big changes throughout so many households in the state of Florida. I think Floridians handled that era of distance learning very well under the circumstances. It's not easy to transition almost on a dime, because we went from the first week and a half of March saying just make sure you cover your nose when you sneeze, to then going in a situation where you saw businesses closing, employees being laid off, and schools going to distance. So it's not like they had a huge amount of lead time, and the teachers and the schools, they had to adapt. And I think that they did a great job. I think our performance in distance was better than most other states, I would say. But at the same time, we just have to realize that there are limitations when it comes to distance learning, and particularly when you're talking about school children that have special needs, because that face-to-face interaction is vital for their nourishment and for their well-being. So we do believe fundamentally in providing parents with the choice, and that choice can be to continue with distance learning or choose to go back into the classroom where your students can get face-to-face instruction. This makes it more difficult on people like Dr. Grego and on some of the administrators, because you don't have a uniform setup. We put everyone in distance, there's going to be millions of parents who are going to want to have the option to go back in, and that wouldn't be doing right by them. But if we said everyone has to go back regardless of what the parents want, you'd have some parents who really want distance. Maybe their child has health condition. Maybe they're just not comfortable. Maybe they have a household situation where they think could be exacerbated. It wouldn't be fair to them. So I think this way it makes it more administratively challenging. There's going to be more things to juggle, but I think ultimately putting the power in the hands of the parents makes the most sense. And this also, gives the school districts a way under current law to function while also not seeing any type of funding reduced, which we think is very, very important. many students will suffer academic and physical and mental health consequences if they're not able to get back into the classroom. I think that that's already happened. It's going to require some more study, but I don't think we can say that the trends in any of those things will have been positive since mid-March here or anywhere in the country. We also understand when you have children with unique abilities, there is even a greater gap between what can be accomplished in distance learning versus the vital instruction that takes place in a whole variety of things here in a place like the Paul B. Stevens ESE Center. 61.4% of Florida's 2.9 million public school students live in low-income households. 71.9% are eligible for free and reduced lunch. That matters because some of those low-income parents, they may not have the same luxuries in terms of the options of what they can do if the school system is not offering in-person instruction as some of the other parents who happen to be more affluent. We hear these different things about some parents are going to create their own learning pods and all this other stuff. And just understand, that is really going to be dependent on financial wherewithal and what income bracket they're in. When you have working class parents, they really do need to have an option. Some of the low-income families and students, the meals that they get in school are vital to the nourishment of their child. Not every family has access to the computer or the internet, making virtual more difficult. And we have 400,000 Florida students with special needs that rely on in-person delivery of critical support and resources. And again, the virtual is very, very difficult to work when you're in those situations. And so having an in-classroom option is vital to the needs of millions of people, both parents and students, throughout the state of Florida. And while I think the decisions about in-person or virtual should be made on the basis of the best interest of the child, it is the fact that for parents, many have had to shoulder a real significant burden without having the option of sending their kids to in-person learning. We have single mothers who work multiple jobs in order to support their children. It makes it very, very difficult to put the food on the table that mother needs to do if the school is not an option during the day. Hard to find child care if you're low income. Do you have to quit one of your jobs, quit both jobs? How do you make ends meet on rent and groceries? How does all this uncertainty and angst affect the mother's mental health, and how does it affect the overall health of the family? So the parents have had to shoulder a burden too. And again, it's really about what's safe for kids and what's best for kids, but the needs of the parents are important as well. And we should just acknowledge that mid-March through the end of the school year has been very, very challenging for a lot of parents throughout the state of Florida. And so we want to make sure that these choices are there and that they can be exercised. We're not going to force any parent to put their child in in-person instruction if they don't feel that that's the right thing to do. We're having Commissioner Corcoran and school districts working together to provide innovative instruction arrangements so that students learning remotely have the best possible opportunity to succeed. I also think every accommodation should be made for any employee. Certainly the state's guidelines on employment writ large, not just including education, is that anybody who's in a vulnerable category, whether it be through age or health condition to the coronavirus, has to have special accommodations made, and that may mean some teachers need to teach remotely. And I think that we should give wide latitude on that. And if there are teachers that just aren't comfortable doing it, let's just make do with what we have and get the folks back in the classroom who are comfortable being there. But again, I don't think it should be anything where you're like ordering everyone to do X, Y, and Z. Let's just work through this as best that we can. But I also understand that this is something that in a big, diverse state, the way this is implemented is going to vary across the different regions of the state. And so school districts really are in charge of some of these key issues. For example, I said last week look, if you need to delay the year, delay the year by a couple weeks. I'm not telling you what you have to start here or there. Make sure you have all your ducks in a row. Much rather have a successful school year if it's a couple weeks late than kind of go into it and not be ready to handle the situations that may develop. So we really, really, support the school districts making those decisions based on the best interests of the students, and want to continue to do that. And we also understand, we have different postures of this epidemic in different parts of the state. Pinellas, I think, if you look at the indicators, is probably heading in a better direction. I think if you look at the ED visits peaking the end of June for COVID-like illnesses, and then you've seen a decline in hospitalized COVID patients, as well as a decline in the positivity, where they've been, I think, under 10% for much of the last 2 weeks. That is a better trend than some other places. Not that Miami-Dade is trending wrong. They're kind of, they're trending down, but it's slower. So you understand that, and you understand that those are considerations that people are going to make. But safety is paramount. I've said my daughter's 3, my son's 2, and my youngest daughter's 4 months, so they're not school age yet. When my daughter is school age, whatever teacher she ends up in class is going to have a bunch of interesting things to deal with, because she's got a lot of energy and a lot of opinions for a 3-year-old. But I would have no problem, and I would absolutely have my kids in school, because I do think that it's safe to do so. I believe that that this is something that's very low risk for kids, fortunately, and I don't think the science has shown that kids are major vectors of spreading the virus. And so with that in mind, my wife and I both would have a lot of confidence in having our kids in the school system, and that will obviously happen, as they get a little bit older. I know it's a time where there's a lot of anxiety out there. I think that having these choices hopefully can reduce some of that anxiety, because I know when we were in, you go back to the beginning of June, the prevalence was low of coronavirus. People were kind of getting, I think, a little bit more comfortable. Then as we got to the end of the month, you started to see prevalence increase. And as we got into July, you saw, these positive tests. And I think people got apprehensive, and a lot of parents are like, what does this mean, for the school year? And I think there was apprehension about some parents, well, I need to have kids at school, or some saying I may not be comfortable. So I think doing the choice option that we're advocating, I think hopefully will reduce some anxiety among so many families about the school year, to understand that you're going to have a meaningful choice, and you really need to do what you think is best for yourself, your kids, and your family. And government, I don't think, is in the best position to be able to make that on your behalf. So I think this has been extremely challenging circumstances. But I must say, the folks, who've worked in our school systems, whether you have superintendents like Dr. Grego, the teachers, having to really innovate and change very quickly, I think that they've done a really good job. There's nothing that can be done remotely to continue kind of the performance within person. There is going to be a drop-off, but I really think that because of the tireless efforts that Florida mitigated some of the learning gap that we've seen develop in some other areas. I mean, Richard and I were talking, there's some major parts of the country that went virtual, and you have huge percentages of students never logged on once since mid-March. And you just wonder, what's that going to mean, as we go months and years ahead? It's going to be very difficult to put that genie back in the bottle. So I think under very difficult circumstances, we've had so many people really step up to the plate and perform well. So from the governor's office and on behalf of the Commissioner of Education, thank you. We know that it's going to continue to be a challenging time. It's not going to be like the opening of school a year ago, because we're just in different circumstances. But I'm confident that the same ingenuity and know-how spirit that you applied in mid-March, you apply to the upcoming school year, and we're going to be able to give our kids the opportunities that I know we all want. We're going to let Richard say a few things, and then we'll hear from we've got a great group of folks here. We've got some parents, we've got some teachers, obviously we've got the principal, we've got the head of the Central Florida Urban League that I think can really provide some really good information about kind of where they're all coming from in their various positions. So Richard.
Yeah, I just want to say that first and foremost, it's been a great partnership with our Department of Education and all the superintendents from around the state in coming up and collaborating and figuring out how do we move forward into the fall academic school year that's best for parents, best for teachers, best for, and most importantly, best for students. And obviously Dr. Grego is one of my great counselors and oracles that I go to on a regular basis. But we came up with a great solution. I think that gives complete flexibility, as the governor says. It empowers parents to make what decisions is what's best for their children. It protects teachers. It gives certainty in funding. All of the things that you would want to start a school year are now available through the decisions we've made collaboratively with the superintendent. I also want to echo that one of the things that, there's two paradigms. I think as every parent, I'm a parent, every parent wrestles, what's the risk of not sending my kid to school versus the risk of sending my kid to church? And parents have to wrestle with that and figure that out. And we had a great conversation today and with a bunch of parents and wrestling with those decisions. And certainly it's been a factor in our household. Obviously I have 6 children. All of them are in public school. All of my children will be going back to school in the fall. But I also have a mother-in-law and a brother-in-law who live right behind us, and both in very vulnerable situations. My mother-in-law obviously is elderly, and my brother-in-law is a adult with unique abilities. And so it's hard for all of us, but I've balanced both. With the kids, they're fine. I think they're going to be great going back to public school, go back to public school. But I also tell them I don't want you going over to Honey and Uncle Josh's because that's not safe for them. And so all of those are decisions that everyone makes, and we wanted everyone to have that flexibility, to have that opportunity. And we recognize that a lot of people are working, as the governor said, those are real stats in Florida, 72% free and reduced lunch, 60% minority. All of these folks need to have opportunities for them to make the best decision. And we recognize from all the studies, whether it's the 1,500 pediatricians in the Royal Academy or our American Academy of Pediatrics, they say, quote unquote, if we don't give that option, you're permanently scarring the future lives of a generation of kids. And so we don't want to do that either. So where do we put all of this together and come up with a solution that benefits everybody and gives them that empowerment, that choice, that flexibility, and that certainty of funding? And I think where we are is in a great place. I think you're going to see come the end of August, when our schools have all of those different options for students, you're going to see 60 plus to 90%. Most are going to choose face-to-face throughout our whole state. And that's a good thing that option's available to them, and that the schools are taking all the necessary precautions to make sure our education community is safe. And so, Governor, obviously we had the chance to talk to these folks back in the room, but your stories are compelling. As a father, just listening to while you guys were making your decisions made me feel better about my decisions. And so I want to thank you guys for all you do, and obviously, Dr. Grego, your leadership is second to none in the state, and thank you for all you're doing too.
Great. Yeah. Why don't Dr. Grego, floor is yours for make whatever comments you want, but we appreciate your leadership. We understand big curveball thrown into the school year last year, but you guys have really responded well, and I know you guys have been very thoughtful about going forward. So thank you.
Thank you, Governor, and thank you, Commissioner. These are two individuals who I think the issue or the words that have been said most frequently is choice, and we thank you for that, and also for the funding of that choice to allow not only the parents and the students, but also the teachers, because without that choice, we wouldn't have the opportunity, because we have some teachers in similar conditions, we would not have that opportunity to allow and remote teaching if it was all school, brick and mortar, or all like Florida or Pinellas virtual. There's just not enough opportunities. So My PCS Online, which is our innovative approach to this coronavirus as we start off the year, is providing also options and choices for teachers that we will try to, as I speak, we're working to match hand in hand. But I want to say thank you to Paul B. Stevens, the principal in this school, because this is a school that's not only, we call it unique, we call it special, we call it a family, but these are unique opportunities and certainly unique challenges. But this is a great school, and I think sometimes we lose touch with schools like Paul B. Stevens, and we think about a typical elementary, a typical middle, a typical high school, and I'm so grateful that you chose to come to Paul B. Stevens, because this many times gets overlooked, places, very special places like this. So it's really best to listen to the teachers and to the principals and to the parents that are here, Governor. So thank you very much for coming into Pinellas County, Commissioner. Thank you for your leadership.
Yeah, thank you, Dr. Grego. So what we'll do is, why don't we hear Lindsay is a parent. We'll hear from her, and I know we got other parents who we did, so we'll rotate that out. So can you just tell the group kind of your situation, like you told us back there, and why you're making the choice that you're making?
Yes, sir. Thank you. Yes, so my name is Lindsay Sinclair. I have 2 children, one of whom is a 10-year-old boy who has high-functioning autism. So we've really enjoyed having a choice. He does attend a private school, but we are lucky not to have medical complications within our immediate family. So for us, the right choice is to go back to school in person so that he can have the in-person occupational therapy, speech therapy, which to us is very important. I'm very concerned about any social, emotional, and behavioral consequences for staying at home long term. So that's the choice that we have decided to make. But there is no right or wrong choice. That's something every family has to decide for themselves.
Can you talk about, you mentioned back there what you do in your professional life, and then how you had to juggle that during the distance learning that we had March, April, May?
Yes, absolutely. So I work in the mental health field, doing telework and telehealth from home, doing therapy sessions. So what I would have to do with distance learning is, in between patients, run out real quick, kind of throw an iPad at a kid, say, here, get on your Zoom conference, get them logged in, and then run back as soon as I could to get back to work. So it is a lot of juggling, but we do what we have to do.
No, we appreciate it. It's not easy at all. So thank you for that. And then you're using the Gardner Scholarship, did you say?
Yes, we are using the Gardner Scholarship, which has made it much easier for us to get a private school education, because it certainly does add up very quickly. So that has really helped us out a lot to be able to do that.
Well, thank you. All right, the principal, why don't you let us know, I guess, how you all handled the end of last school year, and then, what you think you need to do to get the kids, in a good situation for this school year.
Well, first, thank you for coming out here. We do appreciate everyone coming out to Paul B. Stevens. Just before spring break, we were notified that we were going to go online. And my teachers and I were kind of startled and panicked, but we came through, and our teachers worked hard because all of our students have unique abilities, like you keep saying. And the teachers went the extra mile. My behavior specialist did individual sessions to help with behavioral concerns. And we did a complete 360 and changed everything that we did. We went online. We brought things to parents and their families in their homes. We had therapy sessions virtually, and we did the best we could. And our students participated to the best of their abilities, but the parents were always there. Even if they had work to do or other things, they made it a point to be there, because our students really need that hand over hand and that extra support. So that is what we're going to look at going into the future, is how we can accommodate both online and our parents having that choice to have online because of all the concerns we talked about, and really beefing it up so we provide those supports and services to our families. Coming back to school, we're going to do the same thing. It's important to make students our center, and that's what we're going to do. We're going to accommodate. We're going to make sure there's processes in place. I think we're ahead of the game because of the nature of our environment. We're forever cleaning and separating and making sure students have their own areas because of their sensory needs and different places they need to be out of their chairs, for instance. So we are making sure our classrooms are set up for success.
Donna, did you maybe tell the folks kind of your background as a teacher, how long you've been here, how the online went for you and whether you think there's a need to get the kids back in person.
My name is Donna Kane. I've been a teacher here at Paul B. Stevens for 34 years. We are a school unlike any others. Our students are unlike any others. Our students require the highest level of support, which is why they are served in a center environment. The ratio of students to staff is very low, usually 3 to 1 or less. They require full assistance to engage in all learning activities throughout the day. So when we had to deliver the online virtual instruction, it was a very big challenge for our students. To make it meaningful and effective was very difficult. We gave it our all, we tried our best, but our students cannot participate without having that high level of support, which when they're home would be the parent or the caregiver. Most of our students receive therapies, speech, OT, PT, those hands-on therapies, very difficult to deliver online. But I appreciate you coming to our school, putting us on the map, because we often are under the radar, and it's great that we're going to be known about now. And we will do our best. I mean, we love our kids, and we give it our all, and I'm looking forward to having them back in my class.
Regression, I mean, I guess you probably won't be able to fully measure that until they come back, but I mean, do you fear, just given how important the hands-on has been, that there'll be more regression than you're used to seeing after a summer?
Yes, I keep in very close contact with my parents of my students, and over the summer I've received several emails, so-and-so is definitely their behaviors are regressing, their fine motor skills because they weren't getting the therapy, their language skills. It's definitely going to be regression, but once we get them back to school, back into their routine, because routines are extremely, extremely important, and give them that hands-on instruction that they need, we'll get them back. But yes, I expect to see regression. Mm-hmm.
We appreciate all your hard work. It's very, very important. Lynn, do you want to talk, Executive Director of ESE for Pinellas County School System? Talk a little bit about ESE, I guess, throughout the county, and what options you're giving folks going forward.
Thank you. Well, thank you. I echo what everyone said. We're really grateful that you're here, you and the Commissioner. It's really important to really focus on our students, especially our ESE students, so thank you. And I want to thank Dr. Grego publicly, because he really does care about ESE, and he is really committed to making sure that our students have the services that they need, and is very responsive. So thank you, Dr. Grego. It's, as I spoke about earlier, we are really looking forward to this coming school year. We're looking forward to the majority of our students coming back and being face-to-face with teachers, where we think that that's the best place for them to be. So I do want to say that across the district, our teachers did an outstanding job of communicating with our families. I think what we found really quickly is that being virtual meant that we had to change how we communicated with families. We had to really actually increase it, and to make sure that we were being responsive to the needs of families, try to be as flexible as we could, because of course we knew that everyone was embarking on something very new. One of the things that we are looking forward to for this coming year, because obviously we've learned a lot during this process, is just really increasing the instruction, and the flexibility even more so, I think. As the students come back, we may have to look at how we set our classrooms up very differently, and I have met with focus groups to talk about what that might look like, and to ensure safety for our most vulnerable students. We're certainly looking at increased cleaning protocols. We already do that a lot, but we're looking at increasing that. But we're also looking at ways to infuse additional instruction that will address some of the social emotional needs, really stepping up that structure, making sure that students that might need some things that are additional that we weren't providing before, but we find that we need that when they come back. We'll be sure to be having IEP meetings to discuss what students might need. For the My PCS Online specifically, we are looking at incorporating some additional parent training so that when our parents need more assistance in how to do something virtually, they'll have it. So we will actually write that into the plans for our students. So we are prepared. We are ready for them to come back. I feel like we're going to be releasing some additional protocols specific to our students and our teachers, and that we will share with families. And I think that will increase the confidence in what we're going to be able to provide them as they return.
Thank you for all your hard work. I know it's very challenging given all the different moving parts. I mean, that's true probably in any school year, but this one even more so. Erica, are you okay? Great. Can you talk a little bit about your situation and your child?
I'd be happy to. Thank you for having me. My name is Erica Raff. My oldest son attends Paul B. Stevens. He's 13 and he'll be in 8th grade this year. You just previously heard from his teacher, Donna Kane, who is absolutely wonderful, along with Debbie Thornton and Dr. Grego. Thank you for everything you've all done. For my son, he has Down syndrome and sensory processing disorder. So how does that look? In a home setting, it is completely different than it would in a classroom setting. So it is a night and day comparison by far. For him, he generalizes so many things. So at home for him, asking him to be on the iPad, well, that might look different. Asking him to do his classroom work on the iPad when he sees his iPad as entertainment or games or something different. It's just different to have to try to implement what is being asked to do his education, to go ahead and meet those needs. So we did well. We tried our best that we could with him, but like I said, it's definitely a night and day difference in comparison by large. For him, he has challenges with going out and being social in a public setting. There are a few things that he will enjoy entirely what to do. And school being one of the big ones is that it's an absolute positive, it's a staple in his life that needs to be there. It's imperative for that to happen. For what we did at home for the online schooling, it is so hard to replicate what the teachers, with the aides, with the support, with the therapies do in a home setting. You just can't do that. So for us, the face-to-face and returning back to school definitely is a wise choice for us, and he is looking forward to it. We're looking forward to seeing all the teachers and everyone as well. I'm an at-home pediatric home health care nurse, excuse me.
So just having the option as a parent to be able, there's some place around the country that said we're just doing virtual for the whole semester. We obviously, want parents to have that option, but also someone like you to go in. If there were just only virtual, what would that mean for your child if he wasn't able to get back in the classroom, say, until like January?
If virtual was our only option, I don't think it would be a very good option at all. I would see it as a negative. It's basically, I think for every family, they have their comfort level. For our family, it would not be a positive thing for our son, Jimmy, at all. That is not how he learns. He learns on so many scales. He's a visual learner, but he also has the sensory component that accompanies that. So, there are so many things that have to go along with his education in order for him to be regulated, for him to accept what he is willing to receive. Otherwise, we are just going through the motions, and that's not what we're trying to do. That's not what we're trying to accomplish. That's not how you educate a child, and that's not how you meet their needs.
Thank you. Joyce, can you talk a little bit about, what you do here at the school and your family situation and the need to have folks, have that face-to-face?
My name is Joy Vitrelli. This is my daughter, Victoria Vitrelli, who's actually a graduate of Paul B. Stevens. I am thrilled that we will be going back to school and that I'll be back in the classroom. I'm confident that the recommendations of all the officials have the students' best interests at heart, and not just their academic, but their health interests and their social emotional interests at heart. I think one of the things that maybe gets overlooked is that this is such a safe environment for our children. We have unfortunately experienced that outside of school can be a very unsafe environment. My daughter has been a personal victim of that. And I want to have my students back here because I'm not just their educator, I'm their protector, and I'm their caregiver, and I partner with their families. We have an IEP team, and that's not just the professionals who are here, that's the family as well. And we need to have our kids back at school, our students, so that we can help and support the families in ensuring not only the academic success of their children, but also to make sure that they're safe and to provide them with care and to be another set of eyes on them, to make a commitment to them that we're here for them, to take care of them educationally and just to keep them safe. All of the parents who come to me when I get their students, the one thing I'll tell them is, okay, I might not be able to teach them to make a 3D shape from a 2D net, but when they're in my classroom, I will keep them safe because I know how important that is for parents. And I think that parents really need to be confident that when their students come back to here, with our principal, Deb Thornton's leadership and everybody else's, that they will be safe here. And I believe that that's true across the board. And I'm very grateful that everyone has taken the time to meet here today and let people share their experiences and their viewpoints. And I do believe it's time to get the kids back in school. And I think if for nothing else, there is a very strong safety component to that, to make sure that these kids are safe as well as that they're educated. And thank you for your time.
Thank you for your service. We really appreciate it. Glenn Gilzine is the president or the head of the Urban League of Central Florida. Glenn was on the Pinellas County School Board when they hired the great superintendent here. What was that, 8 years ago? So Glenn's got the great roots here in Pinellas County. So can you talk about just from like your perspective? I know you have a lot of families that you talk about. I know you guys service a lot of lower income families, about the need to give them a choice about whether to send their kid, keep virtual or give them the option to go in person.
Absolutely. And on behalf of the Florida Consortium of Urban Leagues, Governor, thank you for your leadership. Commissioner and Superintendent, thank you for your commitment to our babies. We see it and we know it. So the Urban League was founded 110 years ago on the premise of helping African Americans who moved from the segregated South to the North to compete for the opportunities that exist there, just to come to find out that racism has no boundaries. So one of the old sayings is that if you give a man a fish, he eats for a day, but if you teach a man a fish, he eats for a lifetime. And that's what the Urban League mission is all about. I think about my mom, if she had to provide not only for myself and my 4 other siblings who dropped out of high school, if she had to try and provide for us and teach at the same time, I think it would be virtually impossible. But I do remember what she said to me. She said, "Baby, ain't nobody gonna hire you if you can't read, and ain't nobody gonna invest in you if you have no experience." So what our Urban League has done is revamped our mission statement to focus on the 3 E's: education, employment, and entrepreneurship. So you see, in the black community, there's 2 major anchors: the black business and the school. And without the school, how are our students going to achieve the emotional, social, and more importantly, the nutritional supports that a school brings? That's why we truly advocate that we have to have our schools open. And in some cases, the school is the most safest place, as this parent just mentioned earlier, as it relates to our community. CNBC just recently announced that, and also CBS News, that 40% of all black businesses will close, either have already closed or will close due to COVID-19. So I've already told you one anchor. If we let go of the other anchor, you're basically saying game over for our community. And as a former school board member, I'm asking you, please, to open our schools safely. Groups like the NAACP and the Urban League, which are civil rights organizations, we can rebuild black businesses. I just don't know how we can rebuild any of our kids' childhoods.
No, thank you. I think that's very compelling. And these students here, I think, and I think the testimony's been very compelling about when you're have the students that have the unique abilities, just how vital it is, how safe, this is where they're safe. These are the types, these folks, these teachers keep them safe. They know how to be there for them. So they get the emotional support, all the different types of supports, in addition to just the basic education that's so vital. And you just lose that, much of that when you have a distance learning situation. And so we appreciate, what you do here, Principal Thornton, so thank you. Does anyone else have anything to add about what we need to worry about going forward, or the opportunities going forward? I mean, I think you guys were all really, really good. I enjoyed the roundtable back there. I'm glad some of the other folks throughout Florida are able to see, hear some of your comments now. Good. I
just want to take a moment to thank my families. Without our families, we would have an even more difficult time during this, already difficult time. So I just wanted to thank our families and our teachers for stepping up, and also Dr. Grego, because without that, we would have a tougher road ahead of us. So thank you, and I appreciate everyone's time for coming out. And I welcome everyone back anytime to come see our school when our students are here.
Well, we look forward to doing that, and we appreciate the great work that you're doing. It's important. There's a lot of families and students that depend on it, and I know that many of them are anxious to be able to get back. So thanks a lot. We appreciate it. Dr. Grego, thanks for your leadership. Richard, thanks for working collaboratively with the school districts. Look, at the end of the day, we need having a healthy society and a well-functioning society is kind of the bedrock to battle anything, whether it's a pandemic or any of the other myriad of challenges that we face as a people, that we face as a state, as a country in the past. And so I really believe that, parents being able to, to have the option of sending their kids to face-to-face instruction, I think that will, one, be good for the students. Two, it'll reduce a lot of anxiety that's out there, peace of mind. Obviously, it allows a lot of our parents to be able to continue to put food on the table. So there's so much to recommend for it, and I know that the folks who are in our school systems, are going to want to keep these kids safe. So thank you for being willing to step up and do that. We've got time for a couple questions, and I got to get to my next appointment. Anybody? Richard, do you want to jump in on that?
Well, what the emergency order did was protect them from that. So right now, under current law, it's about your students in seats for 180 days and 900 hours. What we did was give complete flexibility at the request of the districts, so they'd have these flexibilities to give parents and to have the district themselves have the certainty of the funding. So now that funding's guaranteed, and now they can open up their schools and offer parents the variety of choices. Without that, we would probably need a special session or something.
But if they only offer a virtual option, will they lose funding?
That's the current law.
Even in a special circumstance of COVID-19?
Yeah, even in an emergency situation, if you're going to, that's why we did the emergency order in an emergency situation to overcome existing law that didn't give them that flexibility, didn't give them that choice. So thanks to the governor's leadership, now we have given them that choice. And I think if you talk to any superintendent, they'll tell you, and you talk to teachers and principals, talk to parents, they're very thankful that we did that. And we did it short term, so we're not overriding the Constitution. Ultimately, we'll have a legislative session. But we did that to give those guys the flexibility.
And so the point is that had there not been an emergency order, then they would be much more likely to lose funding, because if you didn't meet the statutory requirements, that just happens automatically. You would need to bring the legislature back in for a special session to change it. And so I think what Richard did was provide a roadmap where you have flexibility and are able to keep the funding intact. But look, everybody I'm confident that there's going to be, in person throughout the state. Look, the flexibility of the timing and all that, we're going to leave that to the school districts. I'd much rather them take a little bit extra time, get it right. But I don't think you're going to have a school district in the state that is going virtual for the whole semester. You don't think that's going to happen either.
In fact, it's the opposite. If you look at every survey, these are just surveys right now with, even Pinellas, they're 60-30, tens of thousands of parents haven't even responded. And those are probably likely parents that are going to come face to face. They're just going to do what they traditionally do. So really in Pinellas, you're going to see numbers closer to 80 or above. And every parent should have that choice. Absolutely. So we gave them that flexibility. And they're doing a great job with their innovative learning.
Governor, actually, I have one question for you, one question for you, Commissioner. Governor, first question for you. You keep comparing that you said that we do not have outbreaks so far in our child care center. That's really the best, I think, comparison when it comes to our classrooms with our child care centers and those.
Well, let me just say. But let me qualify that a little bit, because I think that's a little bit different than what I've said. What I've said is that there's no evidence that having childcare open throughout this whole time has been a driver of community spread. That's different from saying that there may be an isolated case or something, and I would have no way of being able to definitively say that nobody in any childcare setting, a caregiver, has ever come down with it. But I would say, I think clearly, it's not been a driver of community transition. So when you're looking at child care education, I mean, obviously, the health of the kids is paramount. Now, I think we've known really early on that for whatever reason, kids are much lower risk than particularly senior citizens, but even people in their 50s and 60s. And that's different than like an influenza outbreak. You go to the Spanish flu, I mean, the young kids, H1N1 even. So that's one thing. But then the other thing is, okay, if you have childcare, schools, maybe the kids really aren't as high risk, but is it going to be like a petri dish and then everyone gets infected and then it spreads throughout the community? And that is the concern. But I think that in our situation in Florida, it's not been shown to be a driver of community spread. And I think that that's something that's very, very important. And incidentally, if you look what's happened in Europe, they've had a variety of different models. They actually had, Sweden just kept the schools open, at least I think up to age 15. And they obviously had an outbreak just like everywhere else in Europe. Norway closed. And they recently put out a joint statement saying there was no difference in Sweden for having the schools open. And even Norway was saying that. And basically Norway said, we're not going to close the schools again due to COVID because, it's a low risk and it's not serving as a big driver of the community spreading through the community. So I think like when you're looking at things like schools, those two things I think are very, very important. And not only I think in Florida, I think they actually looked at it in New York City at the height because they did have child care open too. They had to. And I think even in New York City it was determined that didn't accelerate the community outbreak.
60,000 kids.
But that data is being given to the state. Have you seen that data and can you release that data?
So there's not any specific data. I mean, it's basically like, if there's an outbreak in Pasco County, is the health department tying that to a child care or not? And that's kind of how it's been. And we've not seen, we've seen outbreaks tied to families, obviously, parties, some workplaces, different types of things. But that has not been anything that anyone would point to say has been an accelerator of spread throughout the community. You have a question for Richard, too?
Commissioner, I've spoken to a lot of special needs parents with children with special needs. One of our local districts here has more than 100 openings, and they're scared going into the school year that these schools will still not be able to follow their child's IEP plans, even though it's state and federal law. They said when the schools went virtual, that it was not followed at all, even though the school does remain open. It was virtual, that's supposed to happen. Are you guys going to investigate districts that did not follow? And how do you make sure that these openings are filled and IEPs are followed going forward?
Well, that's the point that you heard today from a lot of parents is for those IEPs, they recognize that face-to-face instruction is absolutely the best delivery model for that. And for the parents that don't have that, that you weren't privy to the conversation, there was a couple parents who have children with underlying conditions that they're concerned about, much like my brother-in-law. And so they've decided to stay home, but they're already working with the district and coming up with innovative ways where maybe they come back to the campus for 1 day or 2 days to get all of their therapies. And so listen, we have 67 districts, we have the best superintendents in the country, we have the best outcomes in the country. There's a reason the Vice President and Secretary of State said we did distance learning better than anyone. And I assure you, every superintendent, every principal, every teacher is going to do whatever they can to deliver the full array of services, even for those who are in distance learning for their IEPs.
So that's not answering the question. Will you guys investigate? Do you think you've heard that schools are not following in
If you have something that concerns you, send it to our office, and we'll be glad to look into it. Absolutely.
Great. I got to run the next thing. Thanks, guys. Appreciate it. Thanks so much. Thank you.